Welcome to the Austrian Society for Hygiene, Microbiology and Preventive Medicine. Our society is a well-established society and goes back to the Vienna Society of Microbiology, which has been founded in 1925. Afterwards, hygiene and preventive medicine was also established. The main objective of our society is to promote hygiene, infection control, preventive medicine and microbiology and all its sub-areas in order to have scientific and practical outcome. One important issue is to promote the well-being of humans and animals and the recovery of patients, especially when they suffer from infectious diseases. Microbiology and its diagnostic can help to find the organism, the pathogen, and to find the correct therapy. Thus, antimicrobial resistance and the prevention of transmission of pathogens is also an important issue for our society. Aspects of environmental hygiene are also of concern to us. Important fields of activities include the organization of scientific meetings, continuing medical education, and the implementation of different projects in this area. I cordially invite you to come with our board members to learn more about the Austrian Society of Hygiene, Microbiology and Preventive Medicine.
From the very beginning on, our society followed an interdisciplinary, multisectoral and collaborative approach. The founding members already included specialists from veterinary medicine, human medicine, as well as agriculture and natural resources. As such, they're already covering the different sectors of the current paradigm, the so-called One Health approach, which is including a triad of animal health, human health, as well as environmental health. As we have recently seen with the COVID-19 pandemics, these sectors are highly intertwined. Therefore, we are pleased that our board members include experts from the diverse areas of One Health. The clustering of competences in the field of hygiene, microbiology and preventive medicine becomes even more important in the future. Due to climate change, as well as changes in our societies, we are confronted with challenges that are raising new medical, microbiology and hygienic issues. As ÖGHMP, we want to contribute here to find future-oriented solutions. With our wide-ranging expertise, we are a national contact point for science, practice, as well as politics.
One focus of the ÖGHMP is microbiology in the field of human, animal and environmental health. The connection to fundamental research topics and the application in clinical medicine are important concerns of our society. Since 2022, there's also a young ÖGHMP branch of our society where we aim to connect young academics, researchers and physicians. We've already had some successful meetings and webinars, and we're planning to offer laboratory observerships for young physicians in training. Our mailing list as well as our social media accounts are important ways to connect our members and to distribute information.
Our society publishes online and free for users the so-called expertisen.oeghmp.at. This is a list of disinfectants for hands, surfaces and instruments whose activity has been tested in at least 2 independent laboratories. The use of safe and effective disinfectants is a very important tool in infection prevention, and the ÖGHMP hopes to support clinics and medical practices in the choice and the selection of safe and effective disinfectants.
Historically, infectious diseases were the most disastrous to humankind. This has already changed, mostly due to the beneficial effects of hygiene. However, classical hygiene still focuses mostly on the infectious agents. Environmental health, on the other side, puts our focus on all the other causes and influences for our health. In doing so, we especially look at the ways we deal with our environment, how we shape the built and the natural environment also to the benefit of our health, but more importantly, how our dealing with nature has negative repercussions on us.
In the specialized field of water hygiene, we are working on measures to prevent infections by water-transmittable pathogens in all areas of life. Drinking water, water for cleaning and personal hygiene, water for sports, recreation, and water for healthcare facilities are essential for public health. Water hygiene assessors who are authorized by the Ministry of Health play an important role in public health. In 2012, the ÖGHMP established an expert group for these assessors as a platform for knowledge exchange and networking. If you're interested, please take a look at our website.
The Austrian Society of Hygiene, Microbiology and Preventive Medicine also represents the field of virology. Virology covers a wide spectrum, reaching from basic research to translational and clinically applied research to virus diagnostics. Furthermore, virological research permanently extends the spectrum of virus diagnostics for epidemiological and clinically relevant questions.
Hygiene is dedicated to and focused on maintenance of all health aspects. Public health, epidemiology, environmental, water, food, hospital, school and social hygiene have become independent sub-areas. Ultimately, they serve a common goal, which recently has come to be known as the One Health concept and includes all aspects of hygiene. This is one of the strengths of ÖGHMP. The representatives from human and veterinary medicine, virology, microbiology and parasitology make it a well-positioned health platform. Also, the membership, comprised of academic as well as other professional groups, let ÖGHMP strongly support all aspects of practical hygiene.
The training of our young colleagues for becoming experienced and well-trained microbiologists and specialists in infection control is one of our main concerns. Well-trained consultants are very important for a high-quality work in microbiology and infection control. Thus, we rely on the experience and the knowledge of our young colleagues. I hope that the presentation of ÖGHMP's activities are of interest for you. If you want to see more of our society, please visit our website and our social media.